Okay, I have my... So I have completed my first check, and I have checked my doctor's orders and gathered my supplies. I am outside my patient's room with my instructor, and I'm ready for my second check. Okay, so I have here Marcus Perez, date of birth 48XX. He had a left knee arthroplasty, and I have some orders to insert a Foley catheter, heparin 500 milligram, 5,000 units sub-Q every 24 hours, and morphine 2 milligrams IM every 4 hours PRN pain. I have reviewed my patient's chart, and I will be inserting the Foley, and I will be giving heparin 5,000 units because he had heparin last at 8:45. Yesterday, it is now 9 o'clock, so I can give it. He last had morphine today at 7:15. It is 9 o'clock. It is too early to give it. And I will be drawing up my medications with my instructor. The label on my heparin reads 5,000 units per mil, so I will be drawing up 1 mil. Hand hygiene. I will clean for 15 seconds. Okay. I will attach my dual needle. I will prep my syringe to 1 mil. I will insert 1 mil of air into my vial, and I will pull up 1 mil, making sure not to have any bubbles. I will scoop. Now I will attach my needle that I will be administering with. I have my label here for heparin 1 mil per 5,000 units, my name, date, and time. Okay. I am now ready to enter my patient's room. I will knock on the door. I will foam in. I'll close the door, then I'll foam in. And now I'm doing a 60-second scan of my patient's room, making sure everything that needs to be connected is connected, checking my patient's demeanor, checking that the bed is at the lowest level, and introducing myself to my patient. Good morning. My name is Julissa, and I'll be the ACC student working with you today. How are you? Good. I'm glad to hear. Before we get started, can you verify your name and date of birth for me? Marcus Perez, 48XX. Okay, thank you. And I have here that you're not allergic to any medications. Is that correct? Okay, good. And if I can see your band, just to make sure I have the right medical record number. Okay, 1443, 003. Okay, thank you. So your provider has put some orders for you this morning. We have an order to insert a Foley catheter, and that is because of the urinary retention that you're having. I also have an order for heparin, 5,000 units. That's for to prevent any blood clots because you had that surgery. And with this medication, sometimes you might develop a rash. So if you notice that you're developing a rash, I need you to tell me immediately. You can also have some easy bruising and some easy bleeding, like when you're brushing your teeth, you can bleed a little bit. If you have any of these side effects, just please let us know. We also have an order for morphine, but I have here in your chart that you had morphine at 7:15 this morning, so it's still a little bit too early. I will come in closer to the time that you're due and see where your pain is at and see if we need to administer that. Is that okay? Okay, thank you. And today we're going to get started with your heparin injection. Just in case you have any reaction, I'm still in the room with you doing the Foley cap. Is that okay? Okay, thank you. So now I'm doing my third check. I'm comparing my medication to my doctor's orders, to my MAR, and to the patient. So I have 500 units per 1 ml of heparin that I'm going to be giving subcutaneous in the outer aspect of my patient's arm. Okay, I did hand hygiene and I'm putting on my gloves. I'm going at the outer aspect of my patient's arm. I will be giving this at a 45-degree angle. I have lifted my bed up to working level. I will now proceed to clean the outer aspect of my patient's arm and allow for it to air dry. It is now dry. I can proceed to give my injection. Okay, making sure my bevel is up. I'm going at a 45-degree angle. I'm administering my medication. Okay, medication administered. With one hand, I'm activating the safety. And now I'm discarding in the sharps container. Okay, thank you. Now we're going to do your Foley catheter. Have you had a Foley catheter inserted before? You have? Okay. So there shouldn't be much pain. There might be some discomfort and you might feel a little bit of pressure. That's okay. But you shouldn't feel any extreme pain. If you do, please let me know so that I can stop. Hand hygiene. Touching only the outside 1 inch. Okay. I wouldn't have touched my patient's legs in real life because they would have stayed open, but I am right now for demonstration purposes. And my patient is in the dorsal recumbent position. Making sure not to cross the sterile field. My sterile gloves. Touching the outside of the glove. Under the cuff. Okay, now I can touch sterile to sterile so that I can adjust it. Okay, dispose of this in the trash. Now I'm touching my sterile inside of my kit with my sterile gloves. Touching the inside of this part, again, sterile to sterile. I will now proceed to get my kit ready. I will remove the catheter shield. This is now trash. I will open my lube and I will insert the tip of my catheter into my lube. Put it back in the sterile place. I will now attach 10 cc's of saline for my balloon, still in the sterile kit. I will now contaminate one hand so that I can hold the penis for cleaning. But prior to that, I will set up my 3 swabs. Now this is trash. I'm contaminating this hand. Okay, cleaning around the penis. Then I bring it out and to the side, making sure not to cross my sterile field. Out to the side. Last one. Out to the side. Now I will proceed to insert my catheter. I will insert until I see urine, then I will go 2 inches more. I see urine. I'm going to go another 2 inches. Now I'm going to hold the tip with my hand that I have contaminated so that I may fill up the balloon. Holding it in place with my other sterile hand, I am filling up the balloon. The sterile part is now over. I can use this hand to help detach the syringe. Now I will tape my catheter to the out to the inside part of the leg of my patient, and I will attach my catheter bag to a non-movable part of the bed. Okay, we're all done now. Before I leave, are you in a comfortable position? You are, okay. Is there any personal possessions that I can bring nearer to you? Okay, and is that pain still at 4 out of 10? Yes, and is tolerable? Okay, that's good to know. And can I help you to the restroom? Do you need to have a bowel movement? You do not, okay. Lifting my bed, putting my bed down to the lowest level, removing my gloves, doing hand hygiene, exiting the room. My skill is now complete.